Hi, my name is Miriam. Today I will be performing the dressing change with sterile equipment video. So first thing I'm going to do, I'm going to walk into the patient's room. I'm going to provide patient privacy. I'm going to go ahead and perform hand hygiene and introduce myself to the patient. So after I introduce myself to the patient, I'm going to go ahead and verify the patient's first name, last name, and date of birth. And then I will be explaining the procedure that we will be doing today, which will be a dressing change. And I will explain to her that we're going to change her dressing on her wound. And if she has any questions, to please go ahead and ask during the procedure. And it shouldn't take any longer than 5 minutes. So now we're going to go ahead and get started. We're going to gather all of our supplies. We have hand sanitizer, sterile equipment. We have our clean gloves, and we have the old dressing change with the biohazard waste here. This is where we would be. This is our trash can, our biohazardous waste trash. I'm going to go ahead and perform hand hygiene, and I'm going to apply my clean gloves. Okay, so we're going to go ahead and assess the wound, and we're going to remove the old dressing parallel towards the wound, so we don't put any skin. And we're going to go ahead and change that. Okay. Now we're going to go ahead and inspect the wound for any drainage, any color, any odor, and if we need to measure it, and measurement size. We're going to go ahead and remove our gloves. Okay, and now we're going to go ahead and perform hand hygiene again, and we're going to grab our sterilized gloves from our sterile box. We're going to go ahead and open that. We want to make sure we don't touch anything else that's in there. We're just going to go ahead and grab our gloves. We're going to go ahead and apply them. So when we put on the sterile gloves, we want to make sure that we don't have any nails, any nail polish, that we don't have any rings, and that we don't have any bracelets on. So I'm going to go ahead and apply my sterile gloves on. So first thing I'm going to do, I'm going to grab it by the cuff, and I'm going to apply it. Okay, then with my 2 fingers, I will grab my other sterile glove. Okay, and now I'm going to have a dirty hand and a clean hand. With my clean hand, I'm going to grab my equipment. First thing I'm going to do is grab my my cleaning sponge. So I'm going to go ahead and drop this over here to this dirty hand, which I'm going to be doing the cleaning with. Okay, my cleaning swab. And I'm going to go ahead and start from the inside of the wound in a circular motion. I'm going to go ahead and work my way out. Okay, so now that that's done, we're going to go ahead and place it there. Now I'm going to go ahead and grab the swab, the gauze, the dry gauze, and I'm going to drop it on this hand as well. And then I'm going to go ahead and tap dry it as well, starting from the inside, moving our way outward. Okay, so now that it's dry, I'm going to dispose of it here. Now I'm going to go ahead and grab the transparent dressing so we can change it. This I can actually use both hands with. So I'm going to go ahead and remove it. And I'm going to go ahead and place it on. Okay, so once it's placed, I'm going to go ahead and put the date, the time, and my initials of when the dressing was changed. Now that the dressing is changed, I can go ahead and remove my gloves. I'm going to go ahead and place it here. I'm going to go ahead and gather my supplies, and I am going to put on the lane about biohazardous waist. I'm going to go ahead and perform hand hygiene. I'm going to go ahead and place my patient in a comfortable position. And after I place and give her her call light, and I'm going to ask her if she has any questions, if there's anything else I can do for her. I'm going to thank her for allowing me to change her dressing, and we will be all done. I'm going to go ahead and perform hand hygiene and document my procedure.